Massachusetts is currently experiencing a dire maternal health crisis. From 2011 to 2020, the rates of life-threatening pregnancy complications in Massachusetts nearly doubled, with Black and Indigenous people facing disproportionately high rates of maternal death, severe pregnancy complications, and mistreatment from care providers. These staggering reports come as birthing options and access to care continues to decrease in the state. Since 2020 alone, 4 maternity units in 2 birth centers have closed across Massachusetts, reducing birthing options and access to care. This is where advocating for increased access to midwives and midwife integration comes in. By expanding access to midwifery care in Massachusetts, advocates are looking to fight back against this crisis before statistics worsen. To get this done, on Thursday, October 5th, advocates flocked to the Massachusetts State House for a day of direct advocacy. They spoke to legislators, uplifted the voices of midwives and doulas from across the state, and advocated for 4 pieces of legislation that would advance midwifery access in Massachusetts. These pieces of legislation aim to do 4 things. 1. Create a pathway to licensure for certified professional midwives. 2. Address outdated and onerous birth center regulations that prevent new centers from opening across the state. 3. Guarantee insurance reimbursement for certified nurse midwives. And 4. Institute policies that address long-standing racial inequalities in maternal health.
So the first question is, who are you and why are you here?
We are the proud members and leadership team of the Center for Black Maternal Health and Reproductive Justice and Academic-Based Research Center at Tufts University in the School of Medicine.
Currently in the state of Massachusetts, only about 12 to 14% of our births are attended by midwives. And in hospitals where we have full midwifery coverage, we have better outcomes than in hospitals where there are no midwives or midwives who do not actually get to practice to their full scope and full authority.
The reality of it is the birthing experience is much more pleasant. You have better birth outcomes. You're more likely to initiate and sustain breastfeeding, less likelihood of having C-sections. I mean, the outcomes are just, it speaks for itself. Having a midwife as a part of your care saves lives and makes better outcomes from all birthing.
We know that when midwives are involved with birthing care, families feel centered and heard and supported and held in a way that they do not feel when they have a 5-minute visit in a system that is just trying to extract every penny out of their time.
Midwives are clinical healthcare providers that offer a low-tech, high-touch approach to pregnancy and birth. It's a care model centered on holistic care and informed consent. The midwifery model treats pregnancy and birth as normal life events and uses an empowering, holistic, and individualized approach that many pregnant people actively seek out.
My name is Danette Siegel, and I am a birth doula. I am here today to advocate for midwifery care. Increasing midwifery care will better the quality of life in general across the country, across Massachusetts, across New England. Midwifery care, its founding principle is, I think, autonomy and empowerment for women and other birthing people, and just giving people the power to trust in their bodies and know that they have the power to do what they need to do to birth their babies. Midwifery care brings us, less C-sections, less interventions, better birth satisfaction. And, the beauty of midwifery care is it supports women and empowers them through autonomy and feeling heard and feeling supported and trusting. Like, when my midwives trusted me to trust myself that I knew how to birth and that I could do it, it changed my whole life.
Evidence shows that midwifery care can help eliminate racial disparities in maternal health outcomes by improving patient autonomy and satisfaction. In the case of midwifery, clinical care can be provided in birth centers, at home, or in hospitals, making it a great option for pregnant people looking to give birth in a comfortable setting that is not a hospital. Despite midwifery care's proven benefits, Massachusetts currently ranks 32nd nationwide when it comes to integrating midwifery care into its healthcare system.
Massachusetts remains the only state in the Northeast and in the minority of states that does not guarantee equitable reimbursement for midwives in comparison to physicians. We need to do this. In the city of Boston, you find midwives providing care to many of our underserved, diverse clientele in community health centers such as Chelsea Healthcare Center, Charlestown, Revere, Upham's Corner, Mattapan Community Health Center, Dorchester, East Boston Neighborhood Health Center, and Codman Square, to name a few. In one institution, midwives provide upward of 60% of the prenatal care and 50% of all vaginal deliveries at that institution are done by nurse midwives.
Hi there, I'm Rory Millark. I am the Political and Field Director at Reproductive Equity Now, and I am here advocating for access to midwifery care because this is a huge issue of equity, access, and bodily autonomy, and that's everything we do at Reproductive Equity Now. We know that access to midwifery care greatly reduces the likelihood that a birthing person will need life-saving interventions, and it is a huge, huge way that we can be reducing the rising Black maternal mortality crisis here in Massachusetts.
As of October 2023, Massachusetts state law does not integrate or license certified professional midwives. It also does not allow for certified professional midwives to be reimbursed by insurance and excludes them from practicing in birth centers. To make matters worse, outdated regulations make opening new birth centers more complex and expensive than what the national regulatory agencies require. Today, Massachusetts, a state with nearly 7 million residents, is home to only one birth center.
My name is Nashira Burrell. I'm the director of Neighborhood Birth Center. We're working to open the city's first birth center here in Roxbury's Nubian Square. And I'm here today to plead with elected officials to change the policy and regulatory context in Massachusetts so that birth centers are viable and sustainable. Midwifery care has been proven to improve outcomes, to improve experiences, and to return cost savings to the healthcare system. We have one open birth center in the state of Massachusetts, so increasing access to birth centers and to midwifery care will improve will improve experiences and outcomes here in the Commonwealth. What I'd say about the importance of midwifery care, having given birth to both of my children at home with midwives, is that the hands-on care, the way that the midwifery model treats pregnancy as normal and natural, and the way that for me midwives reflected back to me my own power, such that when I was giving birth in my living room, I felt so incredibly powerful. And I think the more people have access to the safety, the better outcomes, and the reflection back of their own power, the better off we are on a community scale, on an economic scale, on a global scale. When we feel our power, when we're tended to, and when we have better outcomes, everything gets better.
Birthing people, families, and communities in Massachusetts have made it obvious that they want to see the maternal health care crisis addressed now. That's why advocates and organizations across Massachusetts are on the front lines making their voices heard. If you believe in safer maternal health outcomes, addressing racial disparities in healthcare, and expanding access to critical care in Massachusetts, we urge you to get involved by writing to your legislator in support of these maternal health and midwifery care bills today. Thanks for listening, and we'll see you on the next one.
What are we here to say today, midwives?
Save lives!
Midwives!
Save lives! So the first question is, who are you and why